In Chapter 3, we explore our first system, the skeletal system. The objectives are listed in the module. Here are the parts of the skeletal system. Bones, which are the frame of the body, they support and protect our organs. Joints work with the muscular system to make movement possible. Calcium is a mineral required for nerve and muscle function, and it's stored in the bones. Red bone marrow is located in the spongy bone. That's the center portion of the bone, and it's important in forming blood cells. When you were born, the skeleton starts as membranes and cartilage. Remember how we always had to protect a newborn's head? From 3 months to adolescence, cartilage is becoming bone through a process called ossification. This process continues throughout the lifetime, a little slower as we grow older, helping to repair normal wear and tear as well as injury. There's 2 types of bone cells. The first one are osteoclasts that break down or old or damaged bones, and then osteoblasts that help to rebuild bones. So just remember, blasts build. The tissue of the bone is the second hardest tissue in the body and can grow, heal, and reshape itself. The periosteum is the fibrous outer coating of the bone, right here. The compact or cortical bone is dense and strong, therefore it is protective. It makes up about 75% of the bone matter. Spongy or cancellous bone, just like its name says, is more likely to break, and it contains the red bone marrow. Long bones, like the femur and the humerus, and then there's short bones, like the little tiny bones in the wrist and the ankle. The medullary cavity in the center of the long bones is protected by the compact bone. It stores the red and yellow bone marrow. The endosteum is the tissue lining that medullary cavity that holds the bone marrow. There are 2 types of bone marrow. There's red bone marrow, which is located in the spongy bone and forms the blood cells. And then there's yellow bone marrow, which stores the fat. So you can think of it in terms of color. Red forms blood, which is red. Yellow is fat, if you've ever seen fat. Well, like on your steak, is yellow bone marrow, right? Storing fat. As children grow, some red marrow will turn to yellow. There are anatomic landmarks of the bone. The diaphysis is the shaft of the long bone. The epiphysis are the wider ends of the long bone, such as the femurs of the legs. The proximal, remember proximal is closest to, so it's the nearest to the midline of the body. And distal epiphysis is located farther away because it's distant from the midline of the body. A foramen is an opening through which blood vessels, nerves, and ligaments can pass. So for example, the foramen magnum is the hole at the base of the skull that the spinal cord goes through. A process is a normal projection on the surface of the bone, like where a tendon or a muscle attaches. What is the process of repairing or solidifying bone? Remember, in the soft baby head, what are we waiting for? Ossification, exactly. Joints are where 2 or more bones join. There are 3 types. There's the fibrous, which is inflexible, and that's where dense connective tissue is, like in the skull. It's commonly known as a suture. Cartilaginous allows for a little bit of movement, like where the ribs connect to the sternum or the breastbone, or the pubic symphysis. Synovial joints allow for a wide variety of movement. Synovial joints are what we commonly think of when we're talking about joints. Parts of the synovial joints are the capsule, the membrane, the fluid, ligaments, and bursa. There are two types of synovial joints. There's a ball and socket, which allows for a wide range of movement in a lot of different directions. Think of it like the game controller stick, like the hip and the shoulders. Hinge, which is movement in one plane, like backwards or forwards. Think knees and elbows. Here's an example of a ball and socket, which is the hip. And then here's two examples of hinge joints at the elbow and at the knee. Which statement is true? The knee has a cartilaginous joint, the skull, the sternum, or the fontanelle? It's the sternum. Remember, we talked about the ribs connecting to the sternum, allowing for a little bit of movement, for like breathing. We have 206 bones, and the skeleton is divided into two parts. There's the axial skeleton, which is made up of the skull, vertebrae, and ribs, and they protect the major organs of the nervous, respiratory, and cardiovascular system. And then there's the appendicular, which is made up of the 126 bones, including the limbs and the pelvis, that protect digestion and the excretory and reproductive organs. What major organs does the axial skeleton protect? We just said it. The nervous system. The skull is also made up of many bones. The cranium contains the frontal, the parietal, the occipital, which is in the back, you can't see it, it's at the base of your skull, the external auditory meatus, the sphenoid, the ethmoid, and those all come together to protect the brain. Auditory ossicles, or bones, include the malleus, the incus, and the stapes. They are the three tiny bones in the middle ear that help us conduct sound so we can hear. Facial bones are the nasal, so nasal is nose, the zygomatic bone, like around your cheek, maxillary, which is the one that is on top of your teeth, the palatine, which is the hard palate in the roof of your mouth, lacrimal, right here, near your lacrimal or tear duct, inferior conchae, which is right here in the very back behind your nose, the vomer bone, which is that one that runs right in the middle, and the mandible, which is the lower jaw. Bones of the shoulder are the clavicle, or the collarbone, the scapula, or your shoulder blade, and the acromion, which is that little bone that you feel at the end of your shoulder. The bones of the arm are humerus, then radius, and ulna. And the olecranon is your elbow, or your funny bone. Bones of the hand and wrists are carpals. Carpals form the wrist and form a narrow bony passage known as the carpal tunnel. And this is where the inflammation exists when people are experiencing carpal tunnel syndrome. Metacarpals form the palm, and phalanges form the fingers. Each finger has 3 phalanges. There's a distal, it's distant, farthest away from you, middle, and proximal, which is the one that's closest to you. The thumb only has 2, the proximal and the distal. The spinal column protects the spinal cord and supports the head and body. There are 26 vertebrae that have discs of cartilage in between them that act as cushions and allow for movement. The types of vertebrae are cervical, which is the neck area, so there's 7 of those. Thoracic, which is the chest cavity, or thorax, there's 12 of those. There's the lumbar, which is the lower back, there's 5 of those. Then there's the sacrum, which is a triangular bone near the base of the spine, and it's fused, so it's not much movement. And the coccyx, which is the tailbone that forms the end of the spine. The bones of the legs and knees are the femur, or the thigh bone, which is the largest bone in the body. The knees are made up of the patella, or the kneecap, this little tiny guy here, the popliteal space, which is the space behind the knee, the cruciate ligaments that are shaped like a cross that allow for knee movement. Lower legs are made up of the tibia, or the shin bone, or the fibula, which is the smaller of the 2 bones of the lower leg behind the shin bone. The bones of the ankle are tarsal, which is just like the wrist but bigger, the malleolus, which is the ankle bone that sticks out, the talus joins the tibia and the fibula of the lower leg, the calcaneus, which is the heel bone, and there are joints throughout that allow for the foot movement. The feet and toes consist of the metatarsals, which form the foot, the phalanges that form the toe bones, and the big toe is just like the thumb, and for some of us look exactly the same, and have only 2 phalanges, proximal and distal. All the other toes have 3, just like for the fingers. There are bones that are common to the hands and feet. Which bones are those? Do you have ribs in your hands and feet? No. Do you have a humerus in your hands and feet? No. Do you have a femur in your hands and feet? You'd have a problem. So which bones are those? Phalanges, exactly. Here are some examples of medical specialties that focus on the skeletal system. Which type of healthcare provider would see a patient if he needed a spinal manipulation? So let's think about this. Even if we didn't know anything, knowing what we know right now, we could rule out 3 of the 4. What system are we talking about? The bone system. What is the root for bone? It's oste. Which one of these contains the root for bone? Doctor of osteopathy, right? So conditions of the skeletal system in relation to the joints are adhesive capsulitis, or frozen shoulder, a Baker's cyst, which is a popliteal cyst in that area behind the knee. Bursitis is inflammation of the bursa. Remember, itis always means inflammation. Polymyalgia rheumatica is an inflammatory disease of the muscles and joints. A sprain is when a ligament is twisted or torn. And then there's types of dislocations. A dislocation, that seems kind of redundant, huh? Which is exactly what it sounds like, a displacement of the bone from the joint. And then there's subluxation, which is a partial displacement of a bone from its joint, like Steph Curry had. Another disease of the skeletal system includes arthritis, and all arthritises are not created equally. There's osteoarthritis, which is caused by wear and tear. There's gouty arthritis, which is caused by deposits of urate crystals in the joints. There's rheumatoid arthritis, which is an autoimmune disease. There's ankylosing spondylitis, which is an inflammation of the joints between the vertebrae. Juvenile arthritis, and then psoriatic arthritis like Phil Mickelson has. That affects about 20% of the people who have psoriasis. Disorders of the spinal cord are herniated disc, which means it's slipped or ruptured. Spinal stenosis, which is a narrowing of the spaces between the spine. Lumbago, remember lumbar is lower back pain in the lumbar area. Okay, spondylolisthesis. See, I can't pronounce everything either. Forward slipping movement of the lower lumbar vertebrae or the sacrum below it, means it's kind of slipped a disc. Spina bifida is a congenital defect. You're born with it, where the spinal canal fails to close completely. Depending on where it is at, it tells us what kind of effect it will have on the body. Curvatures of the spine that are abnormal, kyphosis, which is the hunchback, lordosis, which is a sway back, and scoliosis as a lateral curving of the spine from side to side. Abnormal conditions of the skeletal system include osteoporosis and osteopenia. So porosis is a loss of bone density. Osteopenia is thinner than average bone density, but you don't have osteoporosis yet. Which word refers to bone? Remember, we talked about that in what kind of healthcare provider would do a spinal manipulation. Oste refers to bone. Another abnormal condition or pathology of the skeletal system includes fractures or broken bones. Types of fractures are closed, which means the bone is broken but the skin isn't. An open fracture where the bone and the skin are broken. And a comminuted fracture where the bone is splintered or crushed. Ouch. Here are some other types of fractures. You can kind of determine what's happening to the bone based on the name. Like the spiral fracture is a fracture that resembles a spiral around the bone as a result of severe twisting. A Baker's cyst is, I can tell you for sure, if you think it's D, you better go back to the beginning of the chapter. A fluid-filled cyst behind the knee, named for British surgeon William Baker. It's an eponym, just like you learned in chapter 1. What kinds of procedures do we do in order to determine the pathology or disease of the skeletal system? Well, we x-ray, right? We look with a scope, like an arthroscopy. We biopsy it with the bone marrow biopsy, or we suck out the tissue with aspiration, usually with a very large needle, or we use MRI to look at the joints when soft tissue is involved. We can also do bone density testing to determine the extent of the osteopenia. Remember, that's where we have thin bones, or osteoporosis, where we actually have bone loss. We can test also using ultrasound, or we can use DEXA testing, which is a X-ray-like procedure that's much more accurate than ultrasound. How do we treat some of the conditions of the skeletal system? We use stem cell or bone marrow transplants to treat some cancers. There's different kinds of transplants. There's allogenic, which is where you need a compatible donor or the stem cells come from the umbilical cord of cells harvested at birth. There's autologous. Auto means, self, which is where the own patient's marrow is returned to the patient after processing. Or there's peripheral, where the patient's own blood-forming stem cells are introduced back. Some procedures that are used to treat joint conditions are reconstruction, arthrodesis, where two bones are fused to limit the mobility of a joint, arthroscopic surgery, with the use of a scope and surgical instruments to fix a joint. There's grafting, where you transplant bone in order to help rebuild a damaged bone. And a synovectomy is the removal of the synovial membrane of the joint. In order to treat disorders of the joint, you can just replace them. That's called arthroplasty. That can be done with the knee, the hip, or the shoulder. For the spine, you can have a discectomy, removal of a disc, or a vertebroplasty, which is injection of bone cement to stabilize compression fractures of the vertebrae. A laminectomy is removal of the lamina. Ectomy means removal, which enlarges the spinal column to relieve pressure on the cord. A fusion is fusing two vertebrae together in order to stabilize the spine. Other procedures can be a craniectomy, ectomy again, removal of a portion of the skull to relieve pressure. A craniotomy, remember otomy is different from ectomy, is a surgical opening. So ectomy is removal, otomy is opening into the skull in order to perform another procedure. An osteotomy is an opening, a shaping and cutting of the bone. How do you treat a fracture? You can have a closed reduction or manipulation, which is non-surgical, owie. External fixation is just that. You use an external appliance to fix the bones in place. Open reduction is a surgical procedure to fix a fracture. You can also immobilize the broken bone with a cast or use traction to use a pulling force in order to fix the bone alignment. Which is the correct spelling for the word that means something that was derived from another person or donor? Allogeneic. Here's some common abbreviations that are also listed in Table 3.1 in your e-text. What does OA mean? I want to take this time to help you break down the question, so even if you don't know the answer, you can figure it out. Does it mean open account? Is this an economics class? That's out. Old ankylosis, is that even a diagnosis with the word old in it? Nope. Occipital arthritis, can your skull have arthritis? It has sutures, but not really flexible joints, so no. Although sometimes I think I have brain arthritis. That's a whole nother issue. Osteoarthritis, we know that to be a real term. So yes, osteoarthritis. How many vertebrae are there in the vertebral column? There are 7 cervical, 12 thoracic, 5 lumbar, 1 sacral, and 1 coccyx. So we describe the location of injuries, conditions, or types of symptoms to expect by using the vertebrae. For example, herniated disc at T7 or back pain at L4-5 level. 26 vertebrae.